When it comes to pregnancy, women carrying a child, there is also impact of what happens in mother's guts to the newborn or unborn baby, even very early throughout the pregnancy. When talking about probiotics for health of a newborn baby, we will talk about how to use probiotics to support the good bacteria during pregnancy and in the newborn phase to experience a lifetime of benefit. We look at latest research on gut microbiome, safety of using probiotics, impact of using probiotics, and most importantly, which ones have been proven to work. There's lots of research looking into intervention, providing a specific probiotic to mother in the last trimester of pregnancy, and observing minimizing risk of developing childhood eczema, atopic dermatitis, asthma, and allergies after the baby is born. So looks like that we can actually affect the health of the baby even throughout the pregnancy by a specific, careful, and defined intervention with probiotics. What we also learn is that the impact is even better and higher in the mothers that are having the allergies, eczema, asthma in their personal history or family history. So in those families, impact of probiotic intervention in the last trimester of pregnancy seem to be even more and even more dramatic or more beneficial for the new baby. So we give a baby better start in life if we do the proper intervention with specific probiotics during the pregnancy. Another interesting factor is that use of antibiotics. Most of us at some point in our lives need to take antibiotics to fight infection, to fight pathogenic bacteria. When we take antibiotics, we affect and we kill good bacteria in our gut. It's some point in our life that has a far impact, so it doesn't only cause issue with the person taking antibiotic for a short period of time, it can have a far-reaching impact, for example, in pregnancy on the baby's health after the baby is born. So that is why mothers taking antibiotics for any reasons should discuss use of probiotics with their healthcare professional at the same time when they're taking antibiotics or even for a period of time after the course of antibiotics is done to ensure their own health and the baby's health is not affected by the course of antibiotics. There is definitely lots of research looking at the connection between what happens in a gut, in a mother, in a newborn child, and the risk of developing the pediatric eczema. We do know that the loss of this early life exposure to other microbial environment is usually linked with the increased prevalence of allergic disease or different kinds of even chronic metabolic diseases as well. You've heard of the hygiene hypothesis. In the last century, there was a huge trend into keeping babies apart from anything that can harm them. So we tend to overdo things. So it was sterilizing their bottles, their soothers, not touching them, washing your hands before you touch the baby, not letting kids play outside because of the fear of catching infections, etc. Boiling absolutely everything, all the toys before they touch it, etc. So that led to the kind of whole generations being raised without proper exposure to microbes that could be very beneficial. We observed that kids, C-section versus vaginal birth, because through vaginal birth, they actually in contact with more microbes from mother. They also pick up microbes from environment, from the caregiver, from breast milk, and they build their own unique blend of microbes in a gut that will actually have a good effect for their own immune responses. We also support throughout the first 3 years of life or more or less, kids pick up other good microbes that will actually carry in their gut for the rest of their life. And it's extremely important to allow them to actually pick up those microbes from the environment. There's a trend or now a push to, we call it, quote unquote, let them play in dirt. It means let them, play with the animals, with the house pets, with the outside environment, with other kids in a neighborhood, because that will actually enhance their gut picking up good microbes from the environment and maintaining the diversity in a gut. So that is one of the reasons why looking at the eczema as one of the issue with the altered immune responses, we look at, can we somehow modify and ensure that gut microbiome is well set, so then it will reduce the risk of developing pediatric eczema. So with the observation that babies born with C-section do have a slower time populating the gut with the good microbes, there have been some research done looking at harvesting the microbes from the mother vagina before the baby was born, and then applying that kind of microbes on a baby's skin. It's called vaginal seeding. And some of the preliminary studies were really promising. And some of the hospitals had started implementing this as a potential intervention. However, it is something that has to be done very carefully, because quite often we might harvest something harmful from mother's vagina as well, and introduce the newborn child that has absolutely no way of, fighting it off. Most of the places that we have where we actually give birth will do analysis and do the vaginal swab to assess for presence of harmful bacteria that can actually cause issues with premature birth or issues with the child when it's born. There are specific bacteria we are looking for. We know this can be very harmful, and they are quite often present in vagina. So we need to do the testing, making sure there's no harmful bacteria. If there is an intervention such as vaginal seeding planned to do with the babies born with a C-section. So I'm hoping that this will become an option for mothers that will have to go through C-section. But at this point, it's not really a standard approach or accepted by everyone because of the fear of potential introduction of harmful bacteria. So looking at interventions that we can use to change, manipulate, alter, or make the gut microbiota better. And we look at different approaches for the specifically pediatric eczema. Lots of studies done, lots of data in different populations. And the reason is that we were looking at, can we somehow maybe improve mother's gut microbiome at the end of pregnancy and throughout breastfeeding that will translate to better messages to the child when it's born to minimize the risk of developing the pediatric eczema. So those studies are impressive. Also, we are looking at using probiotics in kids of different ages, and we use them in kids that maybe do not have eczema, but then we look at the population after a year, whether they have a high risk of developing or lower risk, or using probiotics as intervention for kids that already are presenting with symptoms from early in life or later in life to see those interventions, what are better. And with all this kind of data, it's really difficulty summarizing the overall benefit, and making this guys as a blanket recommendation for probiotic treatments for pediatric eczema. Because again, there are different strains used for different interventions, and again, different population used as a target for the intervention.